Dr. Heinz E. Lehmann is a pioneer in psychiatric clinical investigation and is an international authority in the field of psychopharmacology. Born in Germany in 1911, Dr. Lehmann arrived in Canada in 1937. He would spend most of his career at Douglas Hospital in Montreal, formerly Verdun Protestant Hospital, where he soon started to look for effective treatments for the numerous mentally ill patients hospitalized there.
I've had this drive and the passion almost of finding something that didn't exist, a treatment, a medical treatment in psychiatry, which didn't exist. All we had is psychoanalysis, hypnosis, and in chemical things we had sedatives. That was just about all. These people would go to the hospital then because they were not safe and they couldn't be cared for at home. And many of them would stay there until they were in their 60s or 70s. They wouldn't die from the disease, but they couldn't be cured either.
It's hard to imagine for us who came after to be so helpless and to see the suffering and not be able to do very much to alleviate it. Must have been absolutely excruciating. So he constantly looked at things.
His first breakthrough was in 1953, when Dr. Lehmann found that the drug chlorpromazine effectively treated various psychotic states, particularly in schizophrenia.
We lived about a quarter of a mile from the hospital. We would cycle with friends, and there would be always some patients yelling and screaming obscenities in the windows of the building of the hospital. And overnight, this stopped.
This literally was the revolution. Before that, we were talking of custodial care or psychoanalysis, essentially, were the only two treatments. And here we were, opening up a whole vista of medical, pharmacological treatment of mental illness.
Almost immediately he kept on asking, would anyone have something similar to chlorpromazine for depression?
And then in 1957, Dr. Lehmann was the first psychiatrist in North America to recognize imipramine as an effective treatment for depression.
And here, all of a sudden, 2 or 3 of my patients, after 2 weeks, were symptom-free. I didn't believe it. I thought it was a fluke. It took me 2 years before I really believed there was such a thing as an antipsychotic drug.
Dr. Lehmann's approach integrated scientific, clinical, nursing, and diagnostic skills, which ushered in a new era of care for the mentally ill.
At that time, psychiatry in North America was very strongly dominated by psychodynamics and psychoanalysis, psychological orientation. Now, the new drugs brought back psychiatry into medicine.
The whole perspective changed, not only the scientific perspective, that there was a physical basis of the physical treatment. Now we could call it something that the public would accept. We didn't call it mental disease. They call it, the public usually call it a chemical imbalance of the brain.
In further acknowledgement of his achievements, Heinz Lehmann has 3 distinguished North American awards established in his name.
He's always been a very humble man, a very affable man, a very cultured person. So he's a very great pleasure to work with.
He, as a citizen in this country, has given something to the world. As a Canadian, has given something to the world. Has, I think, made the world a better place in terms of people suffering less. He's contributed to that significantly.
I always wanted to work in psychiatry. I always wanted to work in science and research, and that's what I did.